Okay, it's recording.
All right. Are we live?
Yep.
Welcome, everyone. Welcome to today's webinar from the International Association of Ecology and Health. My name is John Epstein. I'm the Associate Vice President for Conservation Medicine at Ecohealth Alliance in New York. I'll be moderating this discussion today, and today we'll be discussing the relationship between two emerging fields, each focused on creating a more comprehensive approach to health than traditional public health disciplines, Ecohealth and One Health. We have a distinguished panel of 5 health scientists from around the world who will be providing their perspective via short case study presentations and then a discussion following, and then taking your questions to build on a discussion between these two fields. Just as an explanation of the structure for today, each presenter that I'm about to introduce will make a presentation in order. We'll save questions until afterwards. I'll have a few questions for the panel at first, and then we'll open it up to you, the listeners. If you have questions, you can send them via the chat window on WebEx, and we'll take them in the order that we receive them, and we'll do our best to get through as many questions as possible. I'll read them to the panel and read the name of the sender, and then we'll have a discussion there. Just as a reminder, please keep your microphones on mute throughout the webinar in order to reduce background noises. And finally, the webinar is going to be recorded, and it's going to be made available on the IAEH website at www.ecohealth.net. So if you missed part of it today, or if you want to listen to it again later, it'll be made available. Carla, do you have anything to add in terms of mechanics or structure for the presentation?
No, the key things to know is to please keep your microphones on mute to reduce background noise, and generally it works best to hold questions until the end of the presentations, and then I'm going to recommend that you type them into the chat box, and I'm going to demonstrate right now where the chat box is so you know where to ask your questions. So I'm typing it in, please ask questions here. So you should see that pop up in your chat box. And then one last thing, if you run into any technical issues, I invite you to email me at the email address I'm going to type into the chat box momentarily. So if you have any problems with audio or anything else, please send me an email and I'll try and help you out.
Thank you. All right, well, let's begin. As I mentioned, we're joined today by a distinguished panel of scientists who are going to be discussing this topic. Our first speaker is Professor Jakob Zinsstag. Professor Zinsstag is the Deputy Head of the Department of Epidemiology and Public Health at the Swiss Tropical and Public Health Institute in Basel, Switzerland. His main research interests are health of mobile pastoralists and zoonotic diseases in developing countries. The next speaker will be Dr. Moses Chimbari. Professor Chimbari is the Dean of Research at the College of Health Sciences at the University of KwaZulu-Natal. Dr. Karen Morrison is the Vice President of the International Association for Ecology and Health and a member of the Steering Committee of Ecohealth Ontario. Her research focuses on social-ecological systems in public health, including the theme of watersheds as a setting for health and well-being. Professor Nitish Debnath is Professor of Microbiology and Public Health in the Chittagong Veterinary and Animal Sciences University in Bangladesh. He's currently working with the Food and Agricultural Organization in Bangladesh as One Health Coordinator. He's also the National One Health Coordinator of One Health Bangladesh. He's a veterinarian and virologist by training. And finally, Professor Martin Jakob is an emerging infectious disease expert with a focus on the laboratory aspects of disease investigation and research. He worked for the United Nations for 18 years with disease investigation projects in some 150 countries. More recently, he headed up the Australian Animal Health Laboratory with an extensive research program in infectious diseases. He's pioneered the concept of One Health for the past 6 years and chaired the first International Congress on One Health in 2011, and will chair the 4th in 2016 alongside the 6th Biennial Conference on EcoHealth. So that's our panelists. We're going to begin with Professor Jakob Zinsstag. Over to you, Jakob.
Hello, everybody. It's a great pleasure for me to talk to you today as the President of the International Association for Ecology and Health. We are very grateful to the IDRC, the International Development Research Center, to have funded this set of webinars which starts today. We are very grateful that we can publicize more the activities of the IAEH and discuss also fundamental issues. Today we would like to discuss the relationship of One Medicine or One Health and Ecohealth. And I would like to walk you towards a systemic approach to health and well-being. Can I have the next slide, please? I'm talking to you in the same time as the president of the International Association for Ecology and Health, and we have just published a book on One Health. So you can believe me that the relationship, the conceptual relationship of the two issues are very dear to my heart. Next slide, please. So we define One Health as a set of requirements of which we have necessary requirements. We suggest that recognizing the inextricable linkage of human, livestock, companion animals and wildlife is absolutely necessary to work as a One Health approach, but it is not sufficient. We would like to argue that if we can show an added value in terms of better health and well-being of humans and animals, or financial savings, or better ecosystem services that result from such a closer cooperation of human and animal health, then we would call it a real One Health approach. And we try to develop methods that can really demonstrate that. The next slide, please. For example, when we started working with mobile pastoralists in Chad and Mali and other countries in Africa which have large pastoralist communities, we created mixed research teams of doctors and veterinarians. They quickly found out that there were more cattle vaccinated than children. Together with the state authorities of Chad, we created then joint human and animal vaccination teams who were able to vaccinate not only cattle but also children and women. And in this way we could provide healthcare to people who have otherwise no access to healthcare. In the same time we could save up to 15% of the cost by sharing the cold chain and transport. In this way we clearly created an added value of One Health by providing better access to healthcare to people who would otherwise not have access to healthcare, from this closer cooperation between doctors and veterinarians. To the next slide, please. So this is already the next presentations. I believe that there should be more from my side. There has been maybe a mismatch in the sorting.
This is the deck we have from Lisa.
Okay, so I try to explain, don't worry, I try to explain what we mean with One Health, but we recognize today that we have to go way beyond that. We have to include also ecosystems in our equation. If we destroy ecosystem services, if we have no longer clean water or fresh air, we will not be able also to sustain our own health. For this reason, I believe One Health is embedded in the broader conceptual approach of ecosystemic approaches to health. And this is where my colleagues will present further examples where we go beyond just bringing human and veterinary medicine together, but include also approaches to ecosystem health. It's the very last slide of the presentation. If you could just go to that one. Yeah. Sorry, just go to the last slide. This one, yeah. I would just like to exemplify this ecosystemic approach to health at the example of the Canadian Integrated Program of Antimicrobial Resistance Surveillance. Here you see that the Canadians have a very integrated way of looking at antimicrobial resistance surveillance, not only looking at human and animal health, but also at the environment, at rivers, streams, soil, wildlife, sewage, lakes, seas, and so on. And in this way, they grasp a much broader view on how the complex processes of the development of antimicrobial resistance develops. So this is, for me, one of the best examples why and how we should go beyond just considering human and animal health, but consider a broader conceptual approach of ecosystem health. Thank you very much.
Thank you, Jakob. Our next speaker will be Professor Moses Chimbari.
Yes, can I start? Are my slides visible? Hello? Hello?
Hi. Hey, Karen, I'm going to recommend making my colleague Jennifer to share her slides, as I think she also has a full slide deck here, okay?
Yep, fine.
Do I have control of the slides now?
Oh, Moses wanted to do his own. I'm going to pass them. Okay, yes, Moses, now you do. If you go to share and my screen.
Share and my screen, yeah.
And it's just taking a moment, I think, to take effect.
Sorry about that.
Oh, it's okay.
Okay.
I can't see them quite yet. Can anyone else?
I can see them.
Okay, yeah, I can see them.
There we go.
Thank you. I will take over from Jakob, and I'm going to be talking about a case that demonstrates an eco-health approach to health solutions. I'll be talking about a plant called Pathinium historyx, which is a problem in the province of KwaZulu-Natal in North Africa, and it's indeed a problem in other parts of Africa. I will be talking in capacity as coordinator of a new group. It's called the Pathinium Search Group that is working on that project. So as you can see on the screen, you see 4 visuals that clearly show that there are health challenges in terms of skin problems that are caused by contact with this plant that I will be talking about. We can also see that both domestic and wild animals are equally affected, as you can see the animal in the top right-hand corner. And at the bottom, the picture really shows that there are serious agricultural implications of the plant as it takes over a lot of the arable land where crops could be grown. So we have come up with this group to find a solution to tackle this problem, which we think needs a multidisciplinary approach. The plant, just to put things into perspective, I've said it's Pathinium historyx, and you can see the visuals of the plant there. This conceptual framework clearly demonstrates what I've just shown in the previous slide, that there is a health burden. It has got biodiversity implications. It has got serious implications on food security and poverty in general. It takes over agricultural land and affects animals and crops at the same time. Using this conceptual framework, which I have now shown, we showed because of Pathinium historyx, we get a lot of health challenges, biodiversity issues, food security, animal health, and some of the unexploited benefits which would go with that plant. Therefore, the ultimate thing is that there is compromised human and animal well-being. We believe that if we do research that can inform control measures for this plant, we will be able to actually turn everything into green. It means we can be able to improve the human and animal well-being using this approach. Now, what we have done to this to demonstrate our eco-health approach, we have a number of stakeholders that have come together because this problem requires a multidisciplinary approach. We have veterinarians who have taken this as a serious agenda item for 2015 in our province. We have the Department of Health, the Department of Environmental Affairs, Agriculture, Forestry and Fisheries, and from the universities, we do have people from different schools and colleges who are working together to tackle this problem. The group that is working on this has got different work that are dealing with different aspects, animal aspects, human aspects, and social aspects in general. And the coordination team, which is called the Platinum Research Group, will actually be starting to work on this project at the beginning of 2016. So I presented this case just to show that this is a case where we can use an eco-health approach that puts emphasis on systems thinking, community participation, and also taking issues of gender and sustainability into perspective. I'll end here for now.
Thank you very much. We'll move on to our next speaker. Our next speaker is Professor Karen Morrison.
Okay. Do you want me to call the slides back up?
Yeah, Karen, I just passed control back to you.
Okay, thank you. So for the case I wanted to present today is a very new initiative in Ontario, and it's a new group that has come together to work together on eco-health related issues, but specifically with a focus on green space and leveraging the idea of green space to connect environment and health. So this group was began in 2015, so just earlier this year, and the goal is to develop new collaborations among human health, social and environmental sectors to build a common agenda to foster improved health and well-being outcomes for Ontarians through the provision of better ecosystem quality, increased green space, and enhanced access to nature. So the group decided to focus on green space in the first phase because that was an area of common interest. And Ecohealth Ontario is a really interesting group because it's founded by local and provincial health organizations, including representatives from local health units, from the Ontario Public Planners Institute, so the public planning sector in Ontario, representatives of watershed governance agencies, so the groups that look after watersheds in the province, academics, as well as environmental, non-governmental organizations and foundations. So it's quite a diverse group that saw a common agenda around green space and health. Just to give you a few examples of activities that have taken place to date, there's been forums on the health benefits of green space. We had 2 research papers looking at the health benefits of green space and one looking specifically at urban heat islands and climate change, and workshops bringing together people, for example, in Peterborough around shade and shade auditing and planning for shade. And the interest from the public health sector there was on skin cancer prevention as well as wellness. And of course, the foresters were interested in the trees, biodiversity, and all the myriad of other benefits that you get from planting trees in cities. We have a mailing list of several hundred interested parties already, so quite a bit of interest in Ontario in a very short period of time. And really the purpose of bringing this to your attention for this webinar was just to highlight what the values that different sectors see in collaboration and leveraging around health. There really is no forum.
Karen, sorry.
Yep.
Karen, sorry to interrupt. Can you, we're not seeing your screen. If you can share your screen with us, that would be great. Sorry about that.
You're not seeing it. Okay, hold on. I don't see the share screen thing.
You should be able to go in the top left-hand side. Should say File, Edit, Share, View. Does that work?
Okay, Carla, if you can have your colleague just pull them up on her screen, because otherwise we'll just spend too much time on this.
Okay, just a moment.
Anyhow, the significance for the purposes of the webinar is creating this space for the public health and environmental sectors to come together to talk about the issues that are of common interest around health and well-being. Collective impact approach, which is a kind of systemic approach to helping people look for areas of common mutual interest. We try to identify mutually reinforcing activities around policy, research, and communication. And we're finding that there's a number of opportunities with looking particularly for co-funding. So while there may not be a lot of opportunities for single funding, when we put together funding from foundations, environment and health NGOs, and government agencies, we've been able to achieve our goals to date. And of course, being able to look at the issue from different lenses, whether we frame this issue around green space and human health in terms of chronic disease or climate change or biodiversity, we can do those things in order to help move the agenda forward. And we're creating a new public space for discussions about the link between human health and the environment that legitimizes the concerns of the parties and mobilizes action. And what I think is most interesting here is that there really is no focus on zoonoses or animal health. And the group has not been particularly well served by the One Health concept. The Ecohealth concept has allowed, created a space for the environmental agencies to come to the table to talk about health and well-being, and that in a way that wasn't available, or it wasn't seen to be suitable with One Health. One Health tends to deal more with emerging or infectious disease, and that's already fairly well covered in Canada with other agencies and sectors and integration. So Ecohealth has really been able to take advantage of this spot that allows for environmental agencies and public health and planners and other groups to come together. So that's the example that I wanted to bring to this webinar today.
Okay, thank you, Karen. Do we have Nitish on the line again?
Yeah, he is online. Nitish, can you unmute yourself, and we'll see if we can get your audio is working. Yeah, go ahead, John. And
okay, our next presenter will be Professor Nitish Debnath from Bangladesh.
Nitish, can you please unmute yourself?
Hello.
Hello, Nitish.
Yes, can you hear me?
Yeah.
Okay. Hello. Can you show the slides?
Yeah, my colleague is showing the slides right now. You can speak through them.
Okay. And hello, I am speaking from Bangladesh. I would like to start with one statement that Bangladesh is an ideal place to apply all One Health principles, particularly to ensure the healthy human population, animal population, as well as healthy environment. Well, we always focus on the infectious disease, but here I would like to focus another aspect of One Health, and that is about, the food safety as well as the environmental degradation that we are causing. because of the unprecedented human population growth, we have to find the safe food, secure and sustainable food to improve agricultural practice. Here you can see from the slides, I am showing you 3 slides. As you can see in Bangladesh, when we study human population, that we are getting a very high level of exposure of leaf. And as you know, exposure of leaves results in marked irreversible impaired and intellectual function. And it is not only in one case, as I can show you the 3 slides in 3 different parts of the country. And it looks that it is very widespread. And that's why we are very concerned that, it is coming from all sphere of agricultural practices. And that you can see in the second slide. In the second slide, as you can see, the sources of all those leaves are coming from one from milk and also from the agricultural. Can you hear me now?
Can you undo what you just did, please, Nitish? We've got some feedback.
Hello?
Yeah, that's better.
Is it okay now?
Whatever you just did, seemed to have caused some feedback. Can you undo what you just did?
Hello?
Hey, Nitish, did you change something? Can you undo whatever you just changed, please? You were clear initially. I'm going to mute you for now. John, do you want to maybe go to the next presenter? I don't know how to fix that at the moment, so I'm going to try an email with Nitish. John?
Okay, perhaps we can have.
Sorry. Hello. So.
We were having some audio issues with Nitish, so I had to mute him because we were having some feedback. Do you want to maybe skip to the next presenter, I would recommend?
Yeah, we'll come back to Nitish if we can, but right now I'd like to invite our final panelist to speak, Professor Martin Jago. And if we can, we'll come back to Nitish later. Martin?
Can you hear me?
Yes, we can.
So I think you've got the slide up. You had the first slide a minute ago. To talk to you today is an example of an infectious disease that was clearly solved by using a One Health approach. I'm just waiting for that first slide to come up again. There we go. So this is a disease, Hendra, which is a viral infection. The virus survives in the environment in bats and causes disease in horses when there is close contact between horses and bats. It's invariably fatal in horses. There have been very few examples of recovered cases. Now, occasionally we get a spillover from horses to humans with fatality in humans, 70% mortality. So it's a pretty serious disease that moves classically from wildlife into horses and then causes disease in humans. And it has a high mortality rate both in humans and in horses. Causes no disease at all in bats. And the problem is, what do we do about it? And whilst, vaguely speaking, we could talk about segregation of the three species, at the end of the day, they're integrally linked between the bats and the horses and the humans. So how best should we tackle it? The disease first occurred in 1994, and we used the classic methods for a number of years. But in 2011, we came to the conclusion maybe we need to think differently. And we put together in Australia a One Health team, which consisted of wildlife experts, animal health experts, human experts, and importantly, social scientists. And we said, so what are we going to do about this? How best can we prevent this transmission occurring and the disease occurring both in horses and in humans? Next slide, please. Now, there were a number of things we could do. First of all, we could kill all the bats, and that actually was a headline suggestion in one of the newspapers in the state of Queensland, kill all the bats. Clearly, the wildlife people were very upset by this and said this doesn't make sense. It's not going to work anyway, given the large numbers of bats. It is not the solution. The next solution was, well, what about vaccinating humans? And we looked into this. There were a number of issues, but least of which was that it would take some 10 years and perhaps well over $1 billion to develop a vaccine that would be effective in humans, with all the safety trials and so on that needs to happen. And so clearly that's 10 years in which a significant number of horses and potentially humans would be dying. So we then looked at the group and said, well, what about vaccinating horses? If we could vaccinate horses, that would reduce the challenge to humans. And at the end of the day, the horse is the primary clinical host here, not the bat. Fortunately, there was work ongoing in identifying parts of the virus that were responsible for a protective immune response. And indeed, we were able to say that, yes, we think there's a reasonable chance that we can develop a vaccine for horses. So what this enabled us to then do was focus the resources on funding that piece of research. And indeed, in 18 months later, there was a vaccine on the market and being utilised in horses. And so I think this is a really good example of how we might go with One Health. Next slide, please. So I think this is an excellent example of what can be achieved by getting everybody together, by talking through the problem, by looking at the different aspects of it and coming to a conclusion where you need to best focus your efforts on horses. Clearly, in this case, managing the disease in horses reduced the risk to humans, and we suggest this would not have occurred without this One Health approach. The approach was also taken into the field and involved what we needed to do in the field, what we needed to do in terms of policy setting, how the vaccine would be used, and was highly effective. I want to finally, though, mention that I mentioned early on that we had social scientists there. The interesting thing was that their input at that level had been relatively small. It wasn't until we started getting the use of the vaccine and recognised that, in fact, we were still getting cases of Hendra, even though we had the vaccine out there, that the real social science element came into play, where it was pointed out very clearly that most of the horses that are at risk were old horses, and that whilst the owners loved them dearly, they really weren't prepared to pay for the cost of the vaccine. And the vaccine cost for, in Australian terms, is $200 Australian, 220 US dollars for a vaccine course, and that in itself probably is too much for those horse owners to pay for the retired horse that sits out in the field and meets the bats. And so that brings to me my final point, that when bringing together these multidisciplinary teams to tackle the problems in a genuine One Health approach, it's important to include social science. And increasingly, we're seeing that whilst we've got the technical solutions, without including these other elements, such as social science, we may not get the intended full solution we want. Nevertheless, this is a good example of how to use One Health. It was highly successful, enabled us to focus our resources and develop an end solution. So thank you very much.
Thank you, Martin. Do we have Nitish back online?
I recommend we try unmuting him and see how it goes. Nitish, I'm just going to unmute you and we'll see how your audio is working.
Hello?
Nitish. Oh, darn, we still have feedback. We weren't able to fix that feedback problem. I was chatting with Lisa on Skype, and we figured we might want to skip over that for now, but maybe we can make the slides available to folks later if you're okay with that, or something along those lines.
And I would suggest, Nitish, if you can hear, perhaps it's probably because you have a speaker close to the microphone of your phone. I don't know if you're using your computer for audio, but try to just distance yourself a little bit from the speaker.
Yeah, I emailed him those instructions, and but I don't think he was able to phone in, and yeah.
Okay. Well, in that case, thank you to each of our presenters for illustrating cases of where Ecohealth and One Health have made impact. It's clear that both of these disciplines have a lot in common, or actually each of these disciplines have a lot in common in terms of their synthesis or kind of more holistic or comprehensive approach to understanding health issues by looking at animal health, looking at human health, and in some cases integrating environmental circumstances and environmental factors that contribute to health impacts. So I think one of the germane questions today is really, are these different disciplines? How are they distinct? Does one contribute to another, or perhaps are they complementary, or will they eventually evolve into one broader discipline? And so I was hoping that the panel could focus a discussion today on where they see these fields going, whether they're going to converge or operate in parallel, what each one contributes. And I'll start more specifically now before I hand it over to the panel. Infectious diseases are clearly a strong argument for each of the approaches. They're good examples where we have these days many zoonotic diseases that transmit from animals to people, and there have been successful approaches that not only seek to understand how these diseases operate in their natural reservoir, but how they spill over into human hosts and then how outbreaks can be controlled. So there's a very natural connection there between understanding disease dynamics in animals and people, and I think Martin's example of Hendra illustrated that nicely. The question is, when looking at Ecohealth and One Health together as different disciplines, does One Health need to broaden its scope, recognizing that there are environmental factors that contribute to a lot of these disease linkages, or would it be better to think about One Health as a focused area within the broader EcoHealth field, or are they totally distinct? So I'll open that to the panel, and love to get your thoughts on that. Maybe we'll start with Jakob.
Okay. Can you hear me?
Yes, faintly.
Let me
Jakob, you're a bit muffled. Can you perhaps speak a bit louder?
Can you hear me now?
That's better.
Yeah. So from my point of view, or let's say in my working experience, for me it was an extension of working with a One Health approach, looking just at the human and animal health, by looking also, for example, at beta-carotene in grass that cattle would eat, extending that view, for example, also on plant health, which entails the use of pesticides or insecticides. So for me, I think One Health is clearly embedded in the broader concept of ecosystem health approaches. And this has far-reaching consequences because we are only a few looking at such integrated approaches in the whole world. The mainstream in medical sciences goes towards ever more specializations. So we are too few to just deal with such integrated approaches. This is why I would also like to strongly appeal to all of us interested in EcoHealth and One Health to really join forces and not segregating, to really pull ourselves together and not to create further associations or whatsoever. A very good example is the forthcoming EcoHealth and One Health conference in Melbourne in 1 year's time exactly. So I hope very much that there we can further strengthen our collaboration between EcoHealth and One Health-oriented people. Thank you very much.
Martin, do you see it the same way, that these should be integrated, or do you think that they exist separately but are complementary?
It's not an easy discussion, this, and at the end of the day, I think personally there's room for both the Ecohealth and One Health approach. However, I'd make two important points that I think are pertinent to this discussion. One is that the term One Health has a greater appeal politically than Ecohealth. That's just a fact of semantics, if you will. And so in some ways, One Health is a more useful term to cover all what we're doing. But in doing so, we must be absolutely clear in our minds that the environment is crucial, is the third leg of that stool of One Health, if you want to do it that way, that One Health is about animals, about humans, plants, and the environment. And Ecohealth sums that up better, but I believe the term One Health is more universally acceptable to many. The systems approach, which Jakob mentions, is absolutely crucial and is at the basics of whether it's a One Health or an Ecohealth word you use. Having a systems approach is absolutely vital, and I love the word ecosystem. That's my first point I would make, is the popularity of the term One Health. The second point I would make, perhaps equally difficult to deal with, is that I do think that those working in Ecohealth tend to put the environment first. And tend to have a different culture to those working in One Health, who tend to put the health of human beings and perhaps animals above that of the environment. And the Ecohealth people tend to come from universities, tend to work somewhat outside the system, and have a slightly different culture in their way of dealing with things, whereas the One Health person often is actually from public health or within the system, and attaches things and often works in government institutes. And so there is a slight difference between Ecohealth and cultural difference between Ecohealth and One Health. And I actually think that's an advantage. And I'm not convinced that we should lose that, because I think those contrasts are really useful when we're looking at these problems. So at the end of the day, I'd actually like to keep the two separate, but working absolutely together, as Jakob has said. And I think, for example, the One Health Ecohealth conference in 2016 is a way forward. I agree with Jakob that we don't want silos, we don't want too many distinctions, but I like the cultural differences, and therefore I'm comfortable with perhaps the two organisations working close together, but using that having slightly different titles. Thank you.
Good. You mentioned politics and the way that politicians may appreciate some of the nuances or not appreciate some of the nuances when it comes to these issues, academic circles versus practical circles. And in fact, Jakob, in your book, you talk about examples of One Health where they really illustrate an economy or efficiency of approaching health issues, where cooperation between human and animal health could provide a cost savings compared to the two medical disciplines, veterinary and human medicine, working separately but in parallel. Can we find similar efficiencies within EcoHealth? And do you, the panel, do you see politicians able to appreciate the addition beyond human and animal health of environmental issues that relate to health? Can you see a broader appreciation from a practical level at the policy level? And open that to Moses or Nitish, in your experiences.
Yeah, can I go ahead?
Yes, please.
Okay. I also want to comment and say, well, listening to people who advocates for One Health and EcoHealth, and I'm certainly an EcoHealth person, I see a lot of commonalities between the two. Just in today's presentations, it was quite clear that the animal dimension is actually also included in the EcoHealth, and it's included in the One Health. The eco-health perspective to me is more encompassing in the sense that it's looking at the whole system, which I also find from the presentation made today that the approach was looking at the whole system, the horses, the bats, the environment in which they are, and across the disciplines, there was emphasis on the use of social science, which is touching on the human dimension. And I think that there is scope for people to work together, and I certainly agree with Jakob that we should find a way of not creating more silos, because I think it's a question of terminologies that are being used, but essentially we are tackling the problems in a systematic way. We both, I think, both groups put human and animal health in the center and look at the other factors as a complete system. So my perspective is we should try to move closer to each other rather than drift away from each other.
Okay, thank you. Carla, can we bring Nitish back? See if he's resolved some of that feedback.
Sure, we can try. Okay, Nitish, I'm just going to unmute you.
Hi, Nitish.
Okay, go ahead.
Yeah, can you hear me? But
okay, Nitish, can you move away from the speaker?
it's very disturbing.
We'll have less feedback.
You can also try unplugging your headset and then plugging it back in again and see if that helps. Or mute any other microphones or speakers around you, so if you have a built-in one to your computer.
Hello?
Okay, unfortunately we're still getting pretty bad feedback, so we'll have to keep him on
Maybe
mute.
Nitish can type his comments into the chat box.
Okay.
Then Nitish, why don't you try that, and then John can read them out.
Sure, and we'll get to some of those comments too. Let me ask the panel another question then. Given the clear need that you've all demonstrated for a broader approach to health, including environmental and ecological factors, do either Ecohealth or One Health replace traditional public health as a discipline? I mean, is it now obsolete to just talk about public health? Karen?
Yeah, I think one of the things that this desire for more integrated approaches is showing are the limitations of the current public health training and even worldview on tackling some of the big issues that we have around biodiversity loss, around climate change, around disease. But I think it's fair to look at public health as one of several sectors that have an interest in these topics and have expertise to lend to the topics. But I think the whole point of EcoHealth and other approaches is that the issues transcend that of any one individual or any one discipline. And so it's not a critique of public health to say that it can't solve all of these problems, because nobody can. So really the value is in recognizing the need for different professionals and the public, different stakeholders to work together. So I would say that the benefit is to be beyond what's currently framed as public health and look at cooperation with other knowledge holders. And I just wanted to mention that, you know, EcoHealth is not uniquely academic. There are a lot of professionals who are working together in these multidisciplinary teams to try to actually make policy change to protect landscapes and other forums for health. And EcoHealth, the umbrella that we've created, also has been quite explicit about not prioritizing necessarily any one knowledge tradition. And unfortunately, there's a dominance towards positivistic, quantitative approaches to understanding some of the issues that we face. And while those absolutely have a place, and it's not an either-or conversation, There is indigenous knowledge, there's other lived experience, there's, for example, the pastoralists that Jakob works with. There's a lot of other knowledge systems out there that have a lot to contribute to our understanding of environment and health linkages and animal health linkages. And so it's creating a space that allows for philosophers and artists and indigenous knowledge holders and social scientists and more traditional discipline-based knowledge to come together, and not simply to privilege the existing power dynamics around knowledge and the existing paradigms. And I think one of the reasons One Health is a bit more palatable for policymakers right now is it's a bit more of the status quo, but using existing medicalized approaches, public health approaches that respect traditional silos, but try to cross them. Whereas in EcoHealth, we are looking to think more creatively around how do we live in this social-ecological system on this planet and protect both it and human health and well-being and animal health that's embedded in it.
Okay.
John, are you able to see the questions that have come in? Apparently Jakob can't see them, but Lisa can. Can you see the questions through the chat box?
I can, and I was just going to get to them.
Okay.
So
Thank you.
I wanted to bring in some of our listeners' questions, and I think related to what you were saying, Karen, and to this issue of are we lumping or are we splitting in terms of disciplines? This is a question from Mohammed Nurul Islam from Bangladesh, Massey University, and he mentions that there are several disciplines in addition to One Health and EcoHealth. There's planetary health now. We know there's conservation medicine, and I think his question is that are these all not part of a single umbrella, and even public health, starting as we start to come to terms with the fact that these issues we're dealing with are so complex that we need broad multidisciplinary approaches. Where is this heading? Are we eventually going to, is there a unifying principle that we want to adopt, or as Martin says, is there utility perhaps in maintaining names for some of these different disciplines because they serve a purpose or it's convenient? One group understands them as one thing and another group understands them as something else, and that could actually be an advantage to the field. Where do we see things going? Should there be one name and one discipline, or is it useful to have multiple names for essentially what we're working on as something similar or the same? Over to the panel.
Well, I would argue for unity in diversity, which means let us work on integrated approaches by creating new methods that study, for example, the health of people, animals, and humans and plants in the same time, in a way that we can have measurable interconnections. This is a system dynamic approach. But thereby, I don't mind that this may have different names, at least as long as we work together and that we bring different sectors together. I'm sure we are on the right track. In the same time, I don't think this is the end of public health. There are many issues that public health alone can tackle, but we should also not forget that those addresses that need the interconnection of animal health and human health and environmental health, they must be tackled. We should not lose out on those. Thank you very much.
And one example of, or I should say evidence for a change in understanding at the policy level is resource availability. Panel, are you seeing more resources, more funding opportunities available to take these integrative approaches to health issues? Karen, you gave an example of a successful initiative. Are there others out there that you guys know of?
Well, Martin, yes, certainly. One of the problems that has beset our arena, whether it be One Health or EcoHealth, has been the lack of focused funding bodies that provide resources in our area. And so often we have to apply for research funding in a particular discipline, medical research, animal research, albeit the proposal we put forward is an embracing One Health, Ecohealth type of approach, which brings in other groups to that body. But what we've seen, I've certainly seen over the last 3 or 4 years, is an opening of the funding bodies to the concept of One Health. So, for example, the Wellcome Trust, one of the largest research funders in the world these days, they certainly have a resource dedicated to supporting the One Health approach. The Gates Foundation, another major supporter of research, now has a challenge program, the Gates Challenge program, specifically focused on One Health. And increasingly in Australia, for example, our NHMRC, National Medical Health Research Council, has now got a line of support directly for One Health. So I think we're beginning to see that the funders are recognizing what we mean by One Health and recognizing that it's valuable to fund research within that framework of the One Health, Ecohealth, multidisciplinary approach. And I think that's making it easier now for us to get our funding, because we're not, if you will, misusing funds that are meant to focus on agriculture or medical research or environmental research, but we can put it all together under this broader umbrella and everybody's happy. So yes, I am seeing a change.
Yeah, similarly in Canada, the Canadian Institutes of Health Research made a concerted shift in some of the funding that's available under the health research to start to fund environment and health. And so they just put out a fairly large call for proposals linking environment and health. And that's really new, because previously, as in many other places, it's been difficult to find the kind of funding that would allow you to do this kind of work, because the health interpretation and the calls for health funding were quite narrow. The environmental calls didn't respond well to the health angle, because they felt that that was the purview of the health funding stream. And so that's been a welcome development here in Canada.
And I would just add, from the United States government, there's a program through the U.S. Agency for International Development called the Emerging Pandemic Threats Program, which has been probably the largest investment so far from the U.S. government in a program that's designed to support a One Health, or I would argue even an Ecohealth approach, in parts of the world that are most vulnerable to emerging zoonotic diseases, by building capacity locally to look at not only disease transmission between human and animal populations, it's certainly attempting to enhance detection for that and response to that, but also to look at environmental drivers. Are there things such as land change, or deforestation, or agricultural intensification that are actually promoting spillover of pathogens from wildlife into livestock and humans? And this is a large-scale global initiative being funded to the tune of hundreds of millions of dollars. And so there is, I think, at the government level, too, a recognition that this is an important approach to take in terms of global health. Other comments from the panel? Okay, well, we're approaching the hour, and so what I'd like to do is turn it over to Professor Zinsstag. Jakob, did you have any closing remarks you'd like to make?
Well, ladies and gentlemen, it's a great pleasure that you have attended this webinar. I hope this is, well, it is only the first in a series, and we hope very much that we can also motivate more listeners than today. And I'm sure that we can also generate topics from you participants. Please let us know which topics would be of most interest to you. The association is open to the audience and to the membership of the board. You can always see the plans on the new website. The forthcoming webinars are posted there. So please have a look at the website. Thank you very much for your attendance.
Yes, I'd also like to thank the listeners and participants, and I'd especially like to thank our panelists, Drs. Jakob Zinsstag, Moses Chimbari, Karen Morrison, Nitish Debnath, and Martin Jago. Thank you very much for a terrific discussion, and we look forward to seeing everybody at our next webinar. Thank you.
Great. Thank you, John. Thank you, everyone.
Bye-bye.